Hi, I'm Scott Schachter. I'm an optometrist in Pismo Beach, California, and I just wanted to talk to you for a few minutes today about building a dry eye center. I know there's been a lot of articles, a lot of videos, a lot of lectures. I've heard a lot about how to build a dry eye center. And I really think the term build is the wrong word personally. I'll tell you what I think a dry eye center is not. It's not a building. It doesn't require any construction whatsoever. It doesn't require an extra examination room. It doesn't require any modifications to your physical practice at all. Number two, it's not a new schedule. You do not have to block off Tuesday mornings, Thursday afternoons. You do not have to have days where you just run a dry eye clinic. That's not necessary at all. In the same way, we don't have a glaucoma clinic necessarily or a macular degeneration day. It's just part of what we do. So it doesn't require a new schedule. It doesn't require a lot of new equipment. There are a lot of new diagnostic tools that are available, and I think many of them are quite useful. I use a few of them myself. So you might add a couple things, but it doesn't really require any capital investment to begin treating dry eye or building a dry eye center. It's not complicated. It's simple. It's straightforward. What else is a dry eye center? It's a protocol. And when I took on dry eye about 3 years ago, I really decided I wanted to make it part of my practice, a bigger part of my practice, because I'd been neglecting it for years. When I thought about it, I think a dry eye center is truly nothing more than having a protocol to screen for, treat, and follow dry eye in your practice. It's as simple as that. It does require some staff training. It's not that hard, but getting staff involved I think is critical. But you just want to make it part of every exam. Just streamline it. It can be very straightforward. Why should you create this dry eye center? Why should you make dry eye part of your practice if you're not really screening for or looking for it now? Number one, it's about vision. We've read articles and heard a lot about it before. Vision begins at the tear film. When light comes into the eye, it's the first thing it hits. If you don't have a good tear film, you really aren't going to appreciate the vision that you want your patients to have. And when I started thinking of it in those terms, in terms of vision, it went from my lowest priority to my highest priority. I'm an optometrist. We are eye doctors. We are out to provide the best vision possible for our patients, and you can't do that with a poor tear film in quality or quantity. It's also a very prevalent condition. You'll see it every day, and we often overlook it. We wait for symptoms to get pretty severe before we do anything about it. So it's something that's in your practice all day long, and a lot of us, and myself included, used to ignore it. It's a treatable condition. It's fixable. There are lots of ways to deal with dry eye. So it's really something I think that's important to make a part of your practice. Don't think about obstacles. Don't think about how hard you're going to have to work or what you're going to have to do, how many hoops you're going to have to jump through to start treating dry eye. Just start it under next patient. I have a very simple protocol that I put in place after I've really distilled it down after a couple of years, and I'm currently modifying it with some of the newer technology out there. But it's quick and easy, and next time I'll explain in detail exactly what my protocol is. Thanks a lot for watching.